Does that hurt?
No.
Are you on prescription meds, hormones, prednisone?
I already answered that one. I think it was question number 20-something.
Well, yeah, and I could reach down and get it, but that would kind of spoil the whole cool move.
I'm not on any medications.
You vegetarian?
No. Why?
Because you might have something called Cushing's syndrome, which basically means that...
My pituitary is overproducing ACTH, which is causing my adrenal glands to push too much cortisol into my bloodstream.
What a coincidence. I'm a doctor, too.
Yeah, I had it last year. They did brain surgery, removed an adenoma from my pituitary. Where's Dr. House?
Dr. Foreman's overseeing your case. He thought it'd be best if I spoke with you. We found a mass in your pancreas. It looks like cancer.
So something in my pancreas caused me to have a seizure?
Probably. But the bigger point is a 1-year survival rate for pancreatic cancer is less than 20%.
So what's the treatment?
We need to biopsy the mass to see what we're dealing with, and then we can recommend options from there.
Sounds good.
I need your consent to do the biopsy.
Thanks. Wish me luck.
Good luck. It was weird. She barely reacted at all.
I've had people hug me and people take a swing at me.
This was more like she didn't even hear me.
Magnify 3 times.
House assisting. That is funny. Too bad Foreman's gonna die.
Hi. This is a consent form to stick a wire into your brain. It's important for hospitals to get these signed for procedures that are completely unnecessary.
Then why are you doing it?
Because you're mentally ill. You injected yourself with ACTH to induce Cushing's to get attention from doctors. And so far, it's worked.
I'd like to see another doctor.
I'm not giving you what you want.
I don't want a bitch.
Just sign the forms, okay? And I'll get out of here. Hopefully for you, whatever you injected yourself with won't wear off before you get the fun of a caring and concerned doctor cutting into your head.
What did Mommy say? I don't get any candy in my stocking?
Patient being prepped for the venous sampling?
Yeah. A mentally ill patient is right on track for a pointless procedure.
Yeah, we get your objection. Foreman, are you sure? That doesn't make any sense. Check it again. We gotta delay the venous sample.
Why? Her urine turning orange?
How would you know that?
Because that's what rifampin does.
She's not on antibiotics.
But if a Munchausen's patient thinks she's about to get busted, she sees pills labeled dangerous, might cause seizures, she might grab a couple. And if that label were accidentally on a bottle of antibiotics, and if that bottle were accidentally left in her room,
You set her up?
might have. It's Munchausen's. All this she did to herself.
I had a seizure. I'm sick. I need your help.
Not from this department. The half-life of rifampin is 3 hours. After that, you'll get your psych referral and your discharge papers.
You know, just because you stick your fingers down your throat doesn't mean the rest of us are screwed up.
I guess when cooperation fails, you move on to hostility.
I didn't do this to myself.
Whoa! Whoa! Wait up. It's all right, she's gonna stay.
Wonderful.
Oh, bite me.
I don't need to hear the riot act again.
How'd you like another medical test?
What?
Sit.
Why?
So you don't crack your skull when you pass out. Just do it. You know what colchicine is?
No.
Well, don't feel bad. It's for gout. It's got nothing to do with anything you've ever pretended to have.
I'm not pretending.
Shut up. Colchicine decimates your white blood cells, leaves almost no trace. It's great for faking your way into
I
hospitals.
didn't fake my way.
Shut up. You've been doing this for years. Don't worry, it's probably not your fault. When you were a kid, you had a close relative who had chronic disease, probably a sister. You saw the attention she got while you were left alone, ignored. And it really seriously screwed you up.
I do not have a relative.
Shut up! I'm trying to give you what you want. And save your life. You have aplastic anemia.
What, are you trying to scare me now?
Means you're not just sick in the head. The problem is, the rest of you appear as well, so I gotta make you seem as sick as you're supposed to be by injecting you with a drug that simulates the symptoms that you actually have. All you need to know is, you've hit the Munchausen's jackpot. I'm gonna give you a cocktail of insulin for seizure and colchicine to kill your white count. This will absolutely confirm my diagnosis of aplastic anemia. There is one small catch. If you've actually done something to yourself to cause the anemia, then I'm wrong. And if I do what I plan to do, then the treatment will kill you instead of saving you. So I need to know, have you been taking anything besides the insulin, the ACTH, the pills Cameron left in your room?
No.
Good. Give me your arm.
It was my mom. She had MS. She was in and out of hospitals all the time. People were always trying to do things for her. Bring her food or brush her hair or make her happy. People cared. She died when I was 16. And there was no one.
Boo-hoo.
Where are you going?
Well, I obviously can't be around when it happens.
Well, what are you gonna do? You're just gonna...
Relax. You know the drill. People walk by here all the time. You'll be fine.
Who are you?
I'm Dr. Foreman. I'm in charge of your case. You have aplastic anemia, which means your bone marrow is shut down. Your body can't make new blood anymore.
Are you sure?
I went back and checked your old records. It makes sense. The aplastic anemia has apparently been developing for months. I'm sorry, we should have caught it earlier.
So, it's not just the latest white count that's leading you to feel this.
I know this is scary, but a bone marrow transplant could cure you.
A marrow transplant could kill me.
The other option is weekly blood transfusions, injections of GCSF. It's a lifelong regimen.
Yeah, I don't want that.
You sure? I don't want to be cruel here, but you've jumped through a lot of hoops to get this sort of attention.
I just want to be healthy.
It's not so much fun when you're actually sick.
No.
We'll check the registry, see if there's a donor match.
Thank you.
Sir, why do you have 2 lunches in front of you?
Been here for 2 meals.
You're happy with that?
No, I just don't see much use in complaining.
Seriously? It's a very useful tool. Complain, make people miserable. Do what you want, make the misery go away.
We probably should say something. Maybe I can call one of the doctors I work
They're
with.
doing their best.
Ow!
What the hell?
I'm sure it was an accident.
Is he Canadian?
He's a low priority.
Is that a yes?
He's just
Happy. I gotta stop this before it spreads. You guys are done. Could be a metabolic hello again. These people think you are not too nice.
Too nice. For what?
For a life as we know it to have evolved without an intelligent designer, I'm going to prove them wrong. Your wife is very ugly.
Get out of here.
Deb? He's obviously trying to prove a point.
I think I just did. You're either perfect or you're sick. In my experience, sick is much more common.
He's not sick. He's nice.
It's nice in the sense that your toaster is nice for making you breakfast. It's the only thing his wiring will let him do. He has Williams syndrome. Your husband is missing the genes that make him suspicious.
You're wrong. He's...
Relax. There's no cure. He's gonna go right on tasting a lemon meringue pie, fainting, and being a sap.
What about the other symptoms?
Has no other symptoms.
But Williams does.
He's got the teeth, glasses.
Williams cuts IQ by 20.
He doesn't work in the physics department, except when they spill a black hole on their carpet.
elf in appearance.
Yeah, he's more Legolas than Keebler. I bet you can still crack off a batch of pecan sandies.
Perfect pitch.
You'll love to karaoke, right?
I suck.
Modest. Another symptom.
No, he really does suck.
Give us a warble. You know any Cher?
No, but I know Brad. Baby, I'ma want you. Baby, I'ma need you. You're the only one I care enough to hurt about. Maybe I will.
What's the matter?
He's stroking.
Not a moment too soon.
I don't have syphilis.
You don't know.
How many ways are there to get it?
You can know who you had sex with. You can't know who she...
I do.
Not for sure.
It's a waste of time. I had a stroke. You can't keep wasting time. We were tested for the Peace Corps.
10 years ago. You haven't been with your wife every minute of every day.
You think I'm naive, don't you?
I think you... Yeah,
I know my wife.
she's not perfect.
I'm not perfect, but she loves me. And she's always loved me. Every minute, every day. The test must be wrong.
I ran it twice.
Not that test. The one I took 10 years ago. What other explanation is there?
He really sees no other possibility.
Did you have an affair?
No.
Then why aren't you angry with him?
You ever know anybody who's just too nice?
No.
It's annoying. Then you realize it's annoying because they remind you of what you're not. That you'll never be as good as they are. And then you think, why can't I? And before you know it, that naive idiot you laughed at has made you a better person. You really think I've been in love all these years with a symptom?
If syphilis caused lesions in his brain and the lesions caused personality changes, you may notice a change in him as his condition improves.
I know my husband, he's not gonna change.
You should get yourself tested. So much for...
You bitch!
I just went to get us some lunch. You were asleep.
You moved my book.
Jeff, calm down. It's just the drugs.
Drugs didn't move my book.
Jeff. My husband's having a heart
attack! Can somebody help me, please? Somebody help me, please! Doctor.
She saved his life.
Or she scabbed. Depends on your point of view. So what do we think? New symptom or just a wife beater? Hey, time for you to take this baby for a spin.
We loaded him full of prednisone to try to fix the liver.
Good news is, it's running out of organs to fail.
Prednisone could cause roid rage, which could cause hypertension, which results...
Roid rage after 6 hours?
That rate by sundown, they'll have eaten most of us.
It still could be penicillin, allergic reaction.
How does a fried liver put him into a rage?
It's not frying his liver, it's frying his syphilis. Penicillin's working. The real patient is emerging.
So syphilis prevents domestic violence. I'm gonna be even more attractive to the ladies.
I was going to test for a heart issue before the syphilis. PFO could explain the heart attack, and reduced blood flow to the brain could explain the rage.
Well, they're all good ideas. Okay, let's think about how many think it's the roids talking? And who's for the penicillin? And how about whatever she said? Someone hasn't raised their hand.
Whatever I decide. You set me up.
Why would I do that?
PFO.
PFOs have it. Just hope the bubble test is positive. It's no more Mr. Nice Guy.
Okay, got a good view of the heart.
What if we lower House's dosage? Maybe stabilize him? He doesn't get worse, he doesn't get better.
Quite the line to walk. If we're wrong, he dies of neurosyphilis.
If we don't, other people die.
Other people who aren't our boss.
People.
This sucks. The guy had a gift. I killed... Hi, what?
House doesn't have syphilis. He switched the blood samples.
How do you know that?
House told Wilson I wanted to ruin House's day. See ya.
We're idiots.
We're not idiots. Positive blood test means positive blood test.
Apparently not. There they are. Let's see if they... what are you doing? We're not done.
He doesn't have syphilis.
I know.
Good news, bad news. Good news is, you know what you have. It's treatable, you're gonna live.
Really?
What's the bad news?
The cure is a grueling course of pills. It's like one a day for a month.
Now you're just trying to make me laugh.
Yeah, like that's a challenge.
You have Chagas disease. It's a parasite. It's been asymptomatic for 10 years.
Not quite. Your brain's been swollen. Not enough to see, but enough to alter your personality.
Oh, we're back to that.
He screamed at you. You don't think you can change?
That was because of the drugs.
So you think drugs are more powerful than parasites? I mean, the ones we're gonna give you to treat the parasites obviously are, but I stand by the principle.
I'm not worried.
Neither am I.
Neither am I. That's because I don't care.
Look what I found.
Nice.
They think you might be able to come home tomorrow.
Yeah, that's good.
What's the matter?
The ketchup. There's something wrong with that.
Tastes fine. Anything else?
Everything else is great. I don't know. I guess I don't like ketchup anymore. I don't know what else I don't like.
Now, Where were we before we were so rudely interrupted by the liver transplant?
Double decarboxylase was processed normally, and ceruloplasmin and copper levels were normal, so no Wilson's disease.
Gastric content was negative for spores, so no mushroom toxicity.
And initial tests were negative for cancer.
Which cancer were you looking for?
Any of them.
We ran blood tests for ovarian, lung, and lymphomas.
It's not going to tell you much. Her blood was taken after she was given immunosuppressants. They fight rejection. They also mess up our ability to get any clear readings.
Great battles kick up a lot of dirt. Obscure the battlefield so generals can't see what's going on.
So what are your orders, General House?
Sound the retreat.
How you feeling?
Is Max okay?
She's still unconscious, but her vitals look good. We need to stop all the immunosuppressant drugs which are protecting your new liver.
But if you stop the drugs, I'll die.
You're dead anyway if we don't figure out what caused all this. By removing any outside influences, it'll help us see what's really going on with your body.
So you did all this to buy me a couple of days, and now you're taking me back? Will it hurt?
As your body goes into acute organ rejection, your liver will begin to swell. That'll put pressure on. Yeah, it'll hurt. We can knock you out.
No. If Max wakes up, I want to talk to her.
Fever's 106. She's in full rejection mode.
Is that supposed to surprise me?
Her white count is normal.
Normal is not normal. She's been on steroids. The transplant team gave her a cocktail of immunosuppressants. She hasn't slept in over a week. Her white count should be in the tank.
Looks like the problem is some sort of infection. Probably caused a hypotension, shocked the liver.
We should start broad-spectrum antibiotics.
Yeah, you might want to add some chicken soup. It'd be just as useless, but it's got chicken. We need to know exactly what kind of infection we're dealing with. What infection causes sleep disturbance, bleeding, movement disorder, organ failure, and abnormally normal white count.
What about tularemia?
Chest was clear. Tularemia doesn't cause movement disorders.
It would if she developed meningitis.
There was no ulcerations on the skin. With the bleeding, it looks more like leptospirosis.
Without conjunctivitis and elevated creatinine?
What about typhoid or some kind of relapsing fever?
Makes sense if we were in the Sudan.
You sure she hasn't been out of the country?
She hasn't even been out of the state in at least a year. Neither has Max.
Maybe she lied. You talk to her friends, neighbors?
You don't know? Come on, if you don't stay up to date on my notes, where's your next article gonna come from?
Talk to the dog?
We're not as up on foreign languages as you are.
Has the dog been traveling?
It came from a breeder.
Where?
I don't know. A place called Blue Barrel Kennels. They only had the thing for like 2 days.
Blue Barrel is a kind of cactus. You see many cacti in Jersey? Want to see a magic trick?
Since the accident, he's had it.
There you go. Sore my legs. Hey, someone talk to me. Hey, you don't hear me talking to you?
Great heart for transplant.
Who? My heart? Oh, God. They don't know I'm in here.
Hey, genius. I think it violates certain ethical laws to rip the organs out of a guy who's still alive. Possibly
Thank
certain
you.
law laws, too.
Thank you.
Could you, get back in your bed, please, Mr. House?
It's actually Dr. House.
This guy's a doctor.
There's also Navy SEAL House, but you're gonna have to save up for that one.
Really? Well, that's interesting, but you're here because you crashed your motorcycle, not because I need a consult, so get back in bed.
Scrape my elbow. Need a truckload of Vicodin. Where's this guy?
He's brain dead.
No, I'm not.
So drop it.
See that?
Minimal brain waves don't mean he's alive.
I am alive. I'm here.
EEG response to painful stimuli, hot or cold. What you're seeing is random, barely discernible.
I discerned it.
Listen to him, please.
No, that's just the amplifier's internal noise level. It's on increased sensitivity.
No, it's not. It's me.
Then why is his eye following you?
Exactly.
Following motion's an involuntary reflex.
No.
You're a doctor. You should know these things.
No, I'm not dead. I need help. I'm here.
I also know about locked-in syndrome. That things are either involuntary or voluntary. Blink if you can hear me.
I hear you.
Oh, this is gonna be fun.
Eye movement is deliberate. Can you blink once for yes, twice for no?
I hope so.
Square root of 9. You got that faster than you. Brain is fully functional.
Lee.
Where's Molly?
You were in an accident.
Lee, hit the brake, hit the brake, hit the brake!
You sustained a traumatic injury to your brainstem, which has cut off your brain's ability to communicate with the rest of your body.
Can you fix me? Where's Molly?
You still have movement in your eyes, so we can get you to a rehab facility where they can teach you how to communicate.
No. I can't be stuck like this.
Unless the crash didn't cause the brain damage. Maybe the brain damage caused the crash.
Yeah. I could have stopped. Why couldn't I stop?
Look at his palms. No scrapes. He didn't even try to protect himself. Suggests slowed reflexes or no reflexes.
You're not a doctor in this hospital. You are a patient.
Yeah, and
well,
you're the
it's
guy
wacky.
who wants to cut out my organs, and he's the guy who doesn't.
Stroke, cancer, even a simple infection. Anything that insults the central pons can do this.
Then that means I could be fixed.
You're giving him false hope. He needs to accept what's happened and work on making the most of it.
Why would he have a seizure?
Because he has cancer.
His brainstem is compromised.
Why are you still arguing with this guy?
Hey.
You thought I was dead.
Welcome back. And nicely played. You almost died. Exactly as we planned.
You knew this was gonna happen?
Usually happens when you treat cancer by pretending it's not cancer. Right, doctor? My turn.
It's cancer.
No, it isn't.
Yes.
Small tumor in his brainstem causing paraneoplastic syndrome. He needs plasmapheresis.
Can you give that to him?
No, I'm sorry. I completely disagree with Dr. House.
Please shut up.
I don't. Just means I can treat him.
Let him. Let him.
Is that what you want?
Absolutely.
Could you send up a couple of bellboys?
Easy questions. You'll be done before you know it. Is this equation correct?
What, sir? If you make a mistake, I'm not gonna know that anymore?
Are these lines parallel? Special relationships intact. Take a look at this circle. Is more than half of it shaded?
Of course.
Don't forget to blink. Is more than half of the circle shaded?
Sorry. Yes.
Look at me, Lee. Again. Is more than half of this circle shaded?
Blink. Come on, Lee. Blink.
Back out.
Can I blink? Can I blink?
One way to communicate, now that's gone. Well played.
Brain biopsy reveals severe damage to the myelin sheath. The question is why?
Epstein-Barr, coronaviruses, malaria.
He runs a business, meets a lot of people. Could have picked up rotavirus.
You report having bloody diarrhea?
Wife's not sure, says he doesn't complain.
Did you ask him?
We prioritized. He can only blink. A real history would have taken weeks.
If he had Epstein-Barr, he'd have belly pains. If he had the coronavirus, he'd have headaches. 5 other yes/no questions. Maybe we'd know what treatment to give. What treatment would kill him. Unless he's already dead.
Maybe there's another way. Brain-computer interface, better known as BCI. The goal is to get you to move that cursor with your mind. When you think up, the computer records the pattern. Think up enough times, it eventually learns what you're thinking. So, start thinking up.
Metal filings. Judging by the color, I'd say cadmium.
Which he'd aerosolize with the broom, then right into his lungs. Heavy metal poisoning explains everything. The chelation will scrub the heavy metals out of your blood. If we are right about the cause, we should see some movement in about a day or so.
Can't put this thing on turbo? Getting a little anxious in here.
Somebody will be here at all times to irrigate your eyes, keep you company, hopefully help make the time go quicker.
Hand me the fluorescein stain.
What's that mean?
Epithelium looks torn. These drops sting. I'm gonna close your left eye to keep it protected.
Ow.
I'm gonna blink your eye a few times to distribute the dye. Ulcerative keratitis.
Means it's not cadmium poisoning.
Which means you don't know what's wrong. Again, something's wrong. No, my chest. Something's wrong. I think I'm.
Pull the needle out.
Oh God, fine.
Call the code.
Itchy foot. It's liver failure.
The liver's fine. His enzyme has been normal since we admitted him.
I didn't say failing, I said failure, just like you. Liver's like a cruise ship taking on water. As it starts to sink, it sends out an SOS, only instead of radio waves, it uses enzymes. The more enzymes in the blood, the worse the liver is. Once the ship is sunk, there's no more SOS. You think the liver's fine, but it's already at the bottom of the sea.
So dying liver released toxins, damaged the nerves, led to locked-in syndrome.
Now we just need to know what's causing the liver failure.
Liver plus eye plus kidney, most likely sclerosis and cholangitis.
Oh, God, if only Talbot said that. Would have been a happy ending. Do a biopsy to confirm.
I'm gonna numb up the area where we'll go in for the punch biopsy.
Where's the new bracelet?
I'd rather have it at home in the jewelry box than getting peed on at work.
You got the patient's urine on that arm?
When I was putting in the catheter. Why?
You've got a rash.
The bracelet's real.
I figured. So, what if the rash isn't just a rash? What if it's an infection? If there were rats in that basement, then the liver failure could be caused by leptospirosis. Transfers through urine. Rat pee to him, his pee to you. The infection would need an entry point. Look for any recent scratches, cuts.
Look. Next to his fingernail.
The infection destroyed your liver, which released toxins that caused the locked-in syndrome. You were dying of a paper cut.
I hope you're right this time.
We found rats in your buddy Dave's basement. Tested positive for leptospirosis. Means we're on the right treatment. So, try moving a finger. I'm sure you've lost hope. I know we've told you several times that we knew what this was, but this time we're right. Concentrate. Move one finger for me. Gonna make a tiny nick in your forearm, okay? Then I'm gonna time how long it takes for you to stop bleeding. Now, this is gonna sting a little, so you might want to look the other way.
Are those windows locked?
Those windows don't even open. They're just here to let sunshine in.
Good, because they know I'm here.
Clancy, don't bother the doctor with this stuff.
No, it's okay. How do they know you're here?
They put a chip in my neck so they can keep track of me. I can feel it back there.
Clancy, you know there is nothing back there.
There is.
Let me see. Lean forwards.
And they have this other thing. And they put it in between these two ribs, always on the side. And then they move it around my insides. It hurts.
You know what, Clancy? I think I might have found the chip back there. And I think I might be able to get it out.
Really?
Mm-hmm. Okay. Lean forwards. Now hold very still, okay? Got it.
I'm 7, not 3. All you did was pinch my neck.
Sorry. Where's Clancy?
He's asleep.
House. Clancy's gone missing.
Oh, no. You take Alpha Centauri, Foreman can look on Tatooine, and Cameron can set up an intergalactic checkpoint. Let's pray he hasn't got into hyperdrive. We'll never catch him.
Clancy?
I had to go where there were no windows so I could get the chip out, like you said.
God.
I can feel it. I just can't
Clancy,
grab
stop! There is no chip. We're gonna clean you up, and we're gonna go back to your room. You can't do things like this. Parents.
Results came back. The lab cannot identify the metal. Said it might not even be terrestrial.
Really?
No, you idiot, it's titanium. Like from a surgical pin. Like the kind the kid had inserted into his broken arm 4 years ago. Nice medical history.
That pin was removed 6 months after.
So what? Little piece broke off during removal.
Titanium is used to build nuclear subs. Pieces don't just break off.
Tell that to the guys on the Kursk.
And how exactly did it get from his arm to the back of his neck?
Body attacks any foreign object. Inflammatory reaction could erode it into a vein. Fragment gets a free ride.
To his lungs, maybe. Not his neck.
Yeah, an alien chip makes more sense. The real mystery is that you didn't actually screw up.
You okay?
Fine. Tripped. Kid carved a hole in the back of his neck. Apparently didn't bleed to death. Now that's weird.
He clotted on his own?
Sure did. So first there was no bleeding disorder, then there was, now there's not again.
Which is impossible.
Oh?
Foreman screwed up. 2 out of 3 tests agree with my findings.
Well, lucky for us, the 4th test will be the charm.
Too tight?
My parents think I'm crazy.
No, they don't. They're just worried about you, that's all.
I'm not weird. It's just that weird things keep happening to me.
Slight pinch.
If you make me better, do you think the aliens will leave me alone?
I don't think they're going to be bothering you for much longer.
You lying again?
No. We figure this out, everything's going to be okay. Still with us? Pulmonary edema, stage 2 hypertensive crisis.
What is happening?
Wait outside. Get him oxygen and start him on an IV drip of sodium nitroprusside. Get them outside. Here's Clancy's DNA. And here's the DNA from that piece of his heart we just biopsied.
That is impossible. Run it again.
We already did. And once more after that.
The genes from Clancy's myocytes don't match the genes from the rest of his body.
Alien DNA. Seizing. I need clonazepam. I thought you got it all.
Yeah, yell at me. That'll fix the kid.
Obviously, we missed some foreign tissue. There's something still in him.
The hallucinations and seizures indicate problems in the temporal lobe. Sorry, House. It is neurological. Looks like you're wrong, again.
We didn't miss anything. Brain scan was completely clean.
Our tag must not have penetrated the blood-brain barrier. Don't use an IV this time. Get it right into the brain.
No cells are lighting up. His brain is clean. It is not neurological.
His symptoms are neurological. His condition has to be neurological.
His scan was cleaned twice. It's not there.
What if it is there, but didn't show up on the scan? What if the tag just doesn't work in his brain? Brain cells are structurally different, express a different protein.
So, how do we find it?
How does one person end up with 2 different sets of DNA.
We've been through this.
Our assumptions are faulty.
We've confirmed 2 different sets of DNA. We reran the sequence.
I didn't say the lab work was faulty. I said our assumptions were faulty. We assumed he's a person.
Of course. The aliens didn't just visit him, they replaced him.
You're being silly. What if he's not a person? What if he's 2 persons?
I'm not getting the metaphor.
No metaphor. Chase, you said the mom used in vitro fertilization, right?
Yeah, they had trouble conceiving.
Kid was right all along. He was implanted with something. Back when he was young, I mean really young, like 12 cells young. In vitro increases the likelihood of twinning.
But he doesn't have a twin.
Not walking around. But in vitro fertilization costs around 25 grand a pop. So doctors implant 2 to 6 embryos to make sure you get your money's worth. Problem is, there's not always enough bedrooms for all the kiddies. 2 brothers get stuck sharing. There's no bunk beds, so they cuddle up to keep warm. They never untangle. He's 2 people in one. It's called chimerism. Unfortunately, his brother's like a bad doubles partner. The guy just takes up space, gets in the way. Clancy's body thinks that he's gonna put away the easy winners. His brother just keeps swatting balls into the net. We gotta get him off the court.
So does that mean that you can find the bad cells in his brain or not?
Sure, abandon the metaphor. Fine. Clancy thinks differently than his brother because he thinks. If we induce an alien abduction,
Wait, what the hell are you talking about?
the foreign DNA has got to be in a portion of your son's brain that makes him believe that he's being abducted. If we stimulate those neurons with an electric probe, we can trick your son's brain into hallucinating. And your son's neurons will light up, and his brother's cells will remain dark. Those are the ones we cut out. They're gonna get you. They're coming through the walls. They're gonna take you, torture you. You'll never see your parents again.
Clancy?
You got them.
Yep. We got them all.
Close them up.
Everything's gonna be normal again.